The Tobacco Control Integration Project takes what Oregon's Tobacco Prevention and Education Program knows about tobacco control and combines it with what Oregon's health and social service agencies know about their clients and workforce. Smokers with lower incomes or who haven't finished high school are also disproportionately likely to be clients of Oregon's health and social service agencies. Collectively, the agencies provide services to 1 million people, almost 1 in 4 Oregonians. Additionally, we estimate that almost half of Oregon's adult smokers are their clients. This project was an idea that started at a conference with Oregon and Washington leaders representing the state's health and social service agencies. Leaders reviewed data, heard presentations from clients and staff from these agencies, and explored opportunities within each division to implement evidence-based strategies to improve the health and well-being of the clients served and the staff who support them. In 2009, Oregon implemented, next slide please. In 2009, Oregon implemented a comprehensive smoke-free workplace law. With the implementation of our Clean Indoor Air Law, Oregon can work on other smoke-free and tobacco-free environmental changes, such as smoke-free multi-unit housing and community colleges. TCIP was a tobacco-specific Communities Putting Prevention to Work grant. The 2-year goals for that funding included taking all state health and social service facilities serving clients tobacco or smoke-free, increasing policies that require the promotion of and access to cessation resources to clients and employees, implementing a hard-hitting counter-advertising campaign targeted to people struggling to get by, and raising the price of tobacco by 10%, which we know is the best way to reduce consumption among people struggling to get by. Today, I'm going to focus on the project with addictions and mental health. The Addictions and Mental Health Project is referred to as Tobacco Freedom. Next slide. As seen on this slide, TCIP's guiding principles were simple and relied on leadership support. Projects had to come from within the division. This assured buy-in from both clients and staff and high-level support for the work. The work had to focus on environmental, system, and policy strategies, and the steering committee met frequently enough to share information and lessons learned with each other. Next slide, please. Priorities and activities are driven by data from within the agency and among clients and staff, and work toward policies that reduce tobacco use in places where services are delivered, including residential treatment facilities. Agencies identified appropriate partners and action for their client and staff population. Key partners included residential treatment facility administrators, management and staff, clinicians, clients, family members, tobacco control partners, and content experts for tobacco cessation support. Tobacco freedom activities range from adding quit line buttons, like the one seen here on our Health and Social Service Agency websites, to using incentives for staff and residents when engaging in healthy alternatives to smoking, rather than working from a place of punishment. To assure that clinicians were on board and ready to assist in tobacco cessation training for behavioral health providers was implemented across the state. Also, because one of the goals was to implement tobacco or smoke-free properties, an assessment of tobacco-related policies, procedures, and attitudes at all state-funded facilities was conducted to inform the policy timeline and plan. Then, policy implementation training for addictions and mental health facility administrators, managers, and staff were available across the state. Activities referenced on the earlier slide supported the movement to tobacco or smoke-free policies. For tobacco freedom, that meant taking residential facilities tobacco-free. With strong leadership support from Governor Kitzhaber, agency directors, and division administrators, most of these properties will be tobacco-free by July 1st, 2013. Many facilities chose not to wait and implemented their policies this past summer. The facilities that were early adopters found success by engaging residents and staff, collaborating with their local tobacco control partners, identifying champions, and focusing on a culture of wellness. Megan Kahi with Cascadia Behavioral Health Services, and pictured above, helped the Addictions and Mental Health Division clients and staff embrace the Tobacco Freedom Initiative. Megan herself has schizophrenia and was instrumental in changing the attitude about tobacco use within the mental health and treatment community. As a peer wellness coordinator, she has heard from her peers that smoking is like their best friend. She is an inspiring advocate committed to helping people connect with other people instead of a pack of cigarettes. Creating a culture of wellness supported ideas that took a smoking shelter at one of the facilities and turned it into a greenhouse used to grow vegetable starters for the facility's garden, pictured on the coming up slide. Another moving story is a result of the Hazel Center in Jackson County implementing their tobacco-free property. A resident with schizophrenia told his counselor his voices supported his quitting. He's now tobacco-free and has become a champion for his peers who are trying to quit and stay quit. A couple slides forward, we should be looking at the per capita cigarette pack sales. People's life experiences are influenced by their environment. If your environment makes it hard to be tobacco-free, rather than supporting options for tobacco-free living, a person may have all the willpower in the world, but it can still be difficult to quit tobacco or to keep from starting. As seen on this slide, Oregon's per capita sales of cigarette packs dropped 52% between 1996 and 2010, with an increase when the program was temporarily shut down and a return to a decline once it was back up and running. We know what works to prevent people from starting to use tobacco, to protect others from secondhand smoke, and to help people quit. In Oregon, the data shows us that statewide tobacco control programs that are comprehensive, sustained, and accountable are critical for addressing disparities and for reaching the Healthy People 2020 goals to reduce tobacco use among adults and youth. Thank you again for this opportunity to share Oregon's experience, and I look forward to the roundtable discussion.